Hi, everybody. My name is Ricardo, and I am here with the Latino Chamber of Commerce of Boulder County. And today we will be talking with Karen Herrera, which is a bilingual Medicare counselor at Boulder County. Karen, hi. Would you tell us a little bit about yourself?
Sure, thanks, Ricardo. So yes, my name is Karen Herrera. I am originally from back east, born and raised in New York City. My mom is from South America, Colombia. My father's from South America as well, from Argentina. And my husband is from the island of the Dominican Republic. Being from New York, had the privilege of being able to mingle with people from all nationalities and races. And so that was something that I treasure, is diversity.
Wow. Well, that's amazing. You are diverse and all over the country, the Americas over here. Um, Tell me, I understand you're the only bilingual Medicare counselor at the offices of Boulder County?
Yes, that's correct. So I do, of course, do counseling in English, but right now our outreach efforts are trying to let our Spanish-speaking older adults know that we're still here and we're open for business. So we have a slew of counselors, all SHIP certified, which is the state health insurance program. And this is a
Mhm.
national certification, and all of the counselors have this special training.
Wow, wow, cool. That's good to know. I didn't know that certification existed, but that's good to know. So tell me, Karen, what is Medicare? How does it work? I mean, just a little introduction for all the people that don't know.
Sure. Thank you. So Medicare is a federal program. It's administered by Social Security Administration in the sense that they decide who's eligible. So in the plan, it's usually when folks turn 65. You can be under 65 if you have certain disabilities. So for example, if you receive Social Security disability for 2 years, then you would automatically be enrolled in Medicare, whether you wanted to or not. Actually, it just happens. Okay. And then Medicare is also for people who have end stage renal disease. So it's a very diverse in terms of who can be on Medicare. So it's not only our older adults.
Cool. So, but and there's penalties, but we'll talk about that later if you don't register, because that reminds me of the 401k penalty too. If you don't draw your money after a certain age, they draw it for you and they give you a penalty. But um, tell me a little bit about the minimal qualification in order to be eligible to receive Medicare.
So for Part A, which is hospitalization, for that to be free, all you have to do is have paid into Social Security for at least 10 years or be married to someone who had done so. And Social Security has their specific rules around that. So if you ever have an eligibility question and you're asking yourself, am I eligible for Social Security? Do I get premium free Part A? Then Social Security is who you'd want us to talk to about that. And then once you contact Social Security to enroll in Medicare, that's another thing I wanted to share, is that you enroll in Medicare through Social Security, either online or over the phone. Then that's when the Medicare counselor comes into play, and we can help you navigate what plans to go into, talk about penalties, how to avoid them. We can, of course, and we strive to educate the public prior to age 65. We offer Medicare basic classes currently online in English.
Mhm.
So right now we have a class on the 17th of June, which has got about, I want to say, 23 participants already interested. So
Nice.
it's a really big class. We're very excited about it. And certainly we can share with you when upcoming classes are going to be. We will have them every month. So that's for Medicare Basics, so that you'll understand what Medicare is, what the different components of Medicare are, and how to apply.
Wow. Sounds like there are a lot of options out there, and that's why a counselor is necessary to help you navigate, take you by the hand, and help you understand and realize what combination of services and even service providers work best for you. So what if you like to travel a lot? So I'm in Colorado, but I visit my parents in Texas all the time. Uh, is it national? Does that work for me?
That is a great question. And that's one of the questions that we ask when we interview
Hmm.
people for counseling. So there is a plan called Original Medicare, which consists of Part A, which is hospital, Part B, which is medical, and then Part D for the drug plan. And then you can get an optional Medigap or supplement plan because Medicare pays 80% on Original Medicare specifically. They pay 80% of your medical bills, but then there's this 20% that isn't covered. So you can either assume that responsibility yourself as a beneficiary and say, okay, if I'm hospitalized at $100,000 and I have to pay 20% of that, that's $20,000. Am I prepared and able to do that? Or would I prefer to have a Medigap or supplement plan to cover that? Then back to traveling. So if you're traveling and you're going to another state frequently and you'd like to get care there, Original Medicare allows that. You're able to go to any doctor in the United States that accepts Medicare.
Mm. Wow. See, and I, my naiveness, I always thought Medicare was free, period. I also always thought that it was one product that you got, and it's not. There's four parts and some add-ons, and there are costs. So go educate yourself. Call Karen, and she can help you about this. Um, there's also a penalty, so you have to register or else, right? So tell me about that. So people here.
So there can be lifelong penalties attached to Medicare if you're not enrolling in the proper time frame. So there are different enrollment periods. There's the initial enrollment period when you first turn 65 or when your creditable insurance through your employer ends. So let's say that you work until age 70 and you've had large employer creditable insurance through age 70, that's fine. Then right when that ends, that's when your initial enrollment period will begin, and you will want to get that done within 3 months of when that's going to end, so that you can apply for Medicare through Social Security, so you can talk to a counselor and discuss your options, and then think about, would you prefer Original Medicare or Medicare Advantage? What makes sense in your situation and with your finances?
Well, so if I say I'm rich and I don't need insurance because I'm self-insured, I would still get penalized if I don't register for Medicare? Or say if I don't want to register for Medicare, I don't need it for whatever reason, you still get penalized?
I'm going to say no because the penalties happen when you do enroll. So let's say
Oh,
that
okay.
you do enroll by the time you're 80. You figure out, well, I really do need to enroll at that point. So then you enroll, and then the whole time that you should have enrolled, then you're going to get penalties for that.
Gotcha.
Also, penalties if you don't enroll in the Part D drug plan once you turn 65 or once you are eligible, once you have that initial enrollment period. So that's part of what we talked to you about is, are you really in an initial enrollment period, or can you defer and wait because you have your job attached, you have large group insurance that's creditable and you like it and you want to stay there? That is fine, and there's no penalty for that. The penalty happens once that's no longer the case and you need to enroll in a certain time period. Generally, you can enroll 3 months before you turn 65 and within that 3 months after, but we don't recommend that. We recommend trying to get things done in a timely manner so that you don't get accidentally auto-enrolled in a program you don't want. We check your medications. We will ask you to give us a list of every medication that you have, and we will individually check to make sure that either the drug plan or the Medicare Advantage plan has those drugs on the formulary, what pharmacies you like to go to, and approximately how much the cost would be. We also screen you to see if you might qualify for the Medicare Savings Program that can help you pay for your Part B premiums. We screen you for extra help through Social Security, and extra help can help with paying for your drug plan. So, as we discussed that Original Medicare, you'd have to have a drug plan separately.
Hmm.
So extra help can help with that. It can also help on a Medicare Advantage plan, even though it's enrolled, you get a drug plan in the Medicare Advantage, it can help you with the cost of medications.
Wow.
So we do
Cool.
that. We will submit extra help applications for you. We'll refer you to Medicaid for the Medicare Savings Program. We do income screening, everything that you might need.
Right. Well, I've used Boulder County services in other parts. I didn't know there was a Medicare division that can help you. I've used it for regular health insurance, and they did that. They have an initial questionnaire. They figure out all the things they need to learn. They take you by the hand, put you up to the computer and help you enter all the information, and it is great. So, Karen, thank you for your interview. Thank you for all this great information. Why don't you tell us how we can get a hold of you for anybody that wants to call you directly for that initial interview?
Absolutely. So we do have a general number, which everyone's welcome to call. It's 303-441-1546. And any one of our counselors can call you back and we can set you up on an appointment. My direct line is 303-678-6113. You're also welcome to email me at K Herrera at bouldercounty.org.
Excellent. Thank you very much. Just in case you missed it, right down here, there we go, right down here in the description of this chat, we will put Karen's information, email address, phone numbers, and the website where you can get more information. And with that, we'll close out this chat. Thank you very much, Karen, for your time. And until next time.
Thanks, Ricardo. Take care.
Bye-bye.